We have the privilege of presenting the hands-on course on Friday after next year's annual session. It's called The Study of Occlusal Equilibration, a hands-on course.
Yes, it'll be on the Friday after the meeting next year, and this is what we believe is fundamental to all of dentistry, essentially. So general dentists, prosthodontists, orthodontists, oral surgeons, all can benefit from this program.
So we'll be discussing taking a patient, how to identify a patient who has an occlusal problem, and how do you diagnose, how do you treatment plan, how do you get them ready for doing an occlusal equilibration, and then finally, how do we actually go about doing it, and doing it in a predictable manner. Why does equilibration work? Why does equilibration not work? And how do we keep from getting into the pitfalls of an equilibration that doesn't work? We like to make it as predictable as we can and as straightforward as we can.
We'll talk about anatomy, restorative options, instrumentation, who would benefit from this, and how do we get there to the point where we are ready to equilibrate teeth.